My name is Christopher Adams.
Jessie Tan.
Nicole Gallagher.
Jenny Morgan.
Durim Bozhdaraj, and I'm a medical student.
I am 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 a medical student. My name is Christopher Adams. I'm from Minnesota, and I grew up in Germany, and I'm a second-year medical student at Michigan State University. The reason why I want to become a physician really stems from my faith. I'm actually a follower of Jesus Christ, and in that, I believe Jesus to be a healer. As I read the Bible, I see that he heals people, and of course, he probably didn't go to med school. But I think that there's still a really spiritual component to serving people through medicine. I think that it's a way to show people that you care about them, that you love them. And I also enjoy the academic challenge of medicine and the great potential to use it both here in America and overseas in international areas.
My name is Nicole Gallagher. I'm from Ann Arbor, Michigan, and I'm a second-year student at Michigan State's College of Human Medicine. So the reason I wanted to become a physician was that I've always been interested in the sciences. When I got to college, I decided to be a human biology major. I shadowed physicians, physical therapists, as well as working in a research lab. From shadowing the physicians, I realized that the intellectual stimulation as well as the patient-physician relationship got me really interested in the subject. And so I decided to start going down the medical route, and I applied to medical school. Now I'm here.
My name is Jessie Tan. I'm from Harbor Beach, Michigan, and I'm a third-year medical student at Wayne State University. At a young age, I was surrounded by medicine, so those had strong influences in my decision at a young age. My father was a family practice physician. My mother was a nurse. And just going through high school and college, learning more about the nature of the work, the intellectual challenge, and the many different options that one can take a career in medicine, different fields, different specialties. That's what got me into medicine.
My name is Durim Bozhdaraj. I'm from Macomb County, Michigan, and I'm a second-year student at MSU's College of Human Medicine. So I guess the reason why I wanted to become a physician was it's a career that allows you to both interact with people in communication, and it allows you to better patients with their medical needs. Becoming a physician allows you to impact their life and the lives of their families. When patients approach you with medical conditions, they want to seek knowledge from you, and hopefully you're a physician that is able to relate to the patient and understand what they need from you. Becoming a physician is something that I've wanted to do because it allows me, like I said, to interact with patients, interact with families, and just to get a better understanding and help those that are in need.
My name is Jenny Morgan. I'm from Clarkston, Michigan, and I'm a second-year medical student at Michigan State CHM. I think a lot of the reason that I want to be a physician stems from my mom. She worked a lot in social work, and she just really had a drive to always be helping people, always just really be trying her best to go out of her way each and every day to make people's lives better. And I didn't really know how to translate that attitude into my own life. And I think as I got older, I realized that I was excited about medicine and about science and about really helping people in that way. And so she kind of instilled that in me, that serving people is important, and that's really what you should do with your life. And so I think for me that translated as a career in medicine where you can always be learning, always be trying to find something new, always try to find a new treatment, and really just always be trying to serve people better.
All right, medicine to me it's the provision of just taking care of people, no matter where they come from, what their situation is, and without any judgment or prejudice or anything like that. Just taking care of people when they come to you, and getting them taken care of their whatever's interfering with their life, and getting them back into the world so that they can continue living their life. That's what medicine is to me.
Medicine to me is science. It's helping people. It's really just when you go to the doctor and you need to be helped, and the physician has a certain skill set and they help you through it. And that's kind of what I think about medicine.
Medicine is a field that integrates both science and art. As a physician, understanding the science behind treatments and causes of illness is something that you're obligated to know. Being able to integrate art in the field is something that medicine truly brings out in persons that pursue the field.
So medicine, I guess what it means to me is it's this great field of working to help people, as well as educating people and kind of compromise with learning about technology, and kind of comprising that all into one. And so you're teaching people, you're trying to help them with their overall health and learning about new treatments and any of that, and all of that together I think is a really great field to get into.
My definition of medicine, there's probably a couple different definitions. One is the actual medicine itself, just the idea that we can take a drug that can be either poisonous or give us a removal of symptoms or even a cure. And the other thing about medicine is a practice, it's a discipline that we're using those drugs, but in a way that we're caring for patients that are coming to physicians in a time of vulnerability and need. And the broader picture of medicine is how I like to view it.
A compelling experience that I had, as an undergrad, I volunteered at a free clinic, and one of the patients, I had the opportunity to interact with patients as they came in. I'd see them to their rooms and see the way physicians interacted with them to get an understanding of what patients really needed when they came to see a physician. One experience that really sticks out is a gentleman had come in, and I was performing vitals. I was, I'd say, somewhat of a medical assistant. I was doing vitals on the man, and I turned my back, and he fell to the floor and was experiencing a stroke. I was CPR trained, so I immediately started performing CPR on him. Medical attention was called to, but that was an experience that allowed me to truly understand the power behind having knowledge and helping and how to help patients that have conditions. That patient did survive, but that experience was something that will live with me for I'd say my entire life. That it allowed me to understand that I could and I did make a difference in that patient, and me being there and understanding some medical knowledge is probably, safe to say, one of the reasons he's still alive today.
So this summer I went to the Dominican Republic, and it was after my first year of medical school, and I was able to see an American physician and a physician from the Dominican talk about how they treat someone with a brain tumor. And it was so amazing to see them talk to each other. And actually the woman physician from the Dominican actually could do a neurological exam much better than the American physician because she didn't have the technology. And she was teaching her better ways to learn about brain tumors without the technology that we have. And that to me was so crazy, and just kind of embodied everything that medicine is to me. It's just constantly learning, and you can be in an underprivileged environment, you can be in this great Western technologically advanced world, and you can still learn from each other.
The most influential moment for me was my teacher in high school was a physician, and he was an ER doc, and he taught us AP chemistry and AP biology, and he would call us doctor in the class. So Dr. Adams, who'd call me Dr. Smith, Dr. whoever, and he would tell these stories about working in the ER that were just hilarious and great, and he was one of the main factors for why I wanted to become a doctor.
There have been a lot of very influential moments that I've had, but I'd say to kind of sum up the main theme of those moments is that the ability to have this relationship with a patient and see aspects of their life that they don't reveal to anybody, just seeing the most personal and most intimate, personal, and just fragile moments of their experience when they're completely vulnerable in the hospital. They've lost control of everything that they're used to having control of, and just being there for them and comforting them through that situation.
So the most compelling thing in medicine that I've done until now is I volunteered at a clinic, a free clinic in Lansing, as an undergrad. During that time, I got to take patients into rooms, the beginning of physical exam, as well as I shadowed an obstetrician. And that was really the best part, was shadowing the obstetrician. I got to see how he interacted with patients. Most of the patients were Hispanic, they didn't speak good English, so really getting the communication across was interesting to me, and I realized what a struggle it was. And I knew a little bit of Spanish before then, and since then I've been learning more so that I can do something similar to that. And it was just great to see the women throughout their whole pregnancy and how happy they were, and the trust they had in the physician. And that's really the most compelling reason, I guess, that I went into medicine.
So I'm not exactly sure what I want to go into, but right now I'm in the Leadership in Medicine for the Underserved program here at MSU, and that's where my third and fourth years I get to be involved with all sorts of underserved populations in Michigan and in other international settings. And so that's something I definitely want to work into my practice, or the time that I spend as a working physician. And I think I want that to be in urban underserved populations. But if I'd have to say, I think oncology is really interesting, and I think it's a great field to really take care of people that are in a pretty fragile setting and just provide the care that they need.
Alright, so definitely the last few years I've been leaning towards, probably 99.9% towards emergency medicine. The reason is just it's the kind of the first line of defense in medicine. It's a wide variety. A physician has to be well-rounded and ready for anything that comes into the ER.
The area of medicine that I want to go into, I'm not actually quite sure yet, but I do know what kind of physician I want to be in the broader sense. And that is, I just want to be a physician whose patients trust them and who trusts their patients and has a good interpersonal relationship with them, as well as, obviously, I want to be competent in what I'm doing. I would like to work on some global health. In the summers, I would like to go down to Central or South America and work in a clinic down there and just help out. I've been improving my Spanish, and it's something I want to continue working on, as well as helping the people down there. I've been to Central America a couple of times for medical missions and just studying the healthcare system, and it's really intrigued me, and I realized the need for physicians down there, and that's somewhere I want to be.
In the future, how I want to use medicine is in a couple different ways. One is through community health. I really believe in public health and the importance of making a change systematically. So while I love people, I love working with people, and in that, you know, one-on-one aspect, I also want to change systems and communities to help them find the best resources for medicine and health and better health for the community. And how I'm doing that is through a program called Leadership in Medicine for the Underserved, which is at my medical school. And I'm also a National Health Service Corps member, scholar, and I will be using that in an underserved area after I finish my residency in primary care.
I'd say my interest has switched or has changed a lot, but I'm really drawn to OB-GYN, obstetrics and gynecology. I have had the opportunity to witness multiple births and understanding that these births bring the future of what's to come. And being able to take part in that, I feel is a truly special opportunity. I've been blessed in a sense to have good mentors. Our Dean of Admissions here is a OB-GYN, and I am in contact with him a lot and trying to learn his ways on approaching the field. Those are some of the main reasons on why I'm interested in OB-GYN. And again, to focus, the strong point is being a part of something as special as a live birth and understanding that your hands were involved in bringing this person into the world and creating a future. You were right there. That's one of the main reasons why I want to be obstetrician gynecologist.